Hey, good morning. It is great to be back with you again. Always enjoy this time that we get to spend together on Saturday mornings. Today, we're going to jump into a topic that I think a lot of people really are concerned about, and that is the COVID vaccine for our little kids. So it's now been approved for children ages 5 to 11, and there are a lot of parents who have lots of questions. So I have in the studio with me today 2 pediatricians to answer your questions. So we're going to crack open the phones right away so that you can talk to Dr. Scott Myers. Scott's been on the program before. He is double board certified. He is a pediatrician, also master's in public health, and is a pediatric oncologist working at Ascension Hospital and also teaching at the IU School of Medicine here in Fort Wayne. So good to have you back.
Thank you so much, Lee. Nice to be with you.
And also with us today is Dr. Tony Giaquinta. Tony is a local pediatrician, but he's with us today in the role of his past presidency with the Indiana chapter of the American Academy of Pediatrics. So great to have you here.
Thanks, Lee. Great to be here.
So before we jump into the whole COVID thing, I want to hear from you guys what's happening, what's going around, what's hitting our kids right now. You have a concern about something called RSV.
Yeah, we're really kind of in the midst of a major viral Armageddon. There's lots of viruses circulating, which is normal for this time of year. We see kids playing together, and they're in their school environment sometimes, and they spread viruses, and we're seeing a lot of spread. And one of the big viruses that we saw a big uptick in is a virus called RSV. RSV is notorious for causing bronchiolitis. Now, for you and I, that's kind of a headache, maybe a snotty nose and a cough, but for our really young kids, boy, it can cause a major respiratory distress. So it's one that we watch closely. The good news with RSV is it is a virus, and it goes away with time. With our immune systems kick in with time, and we keep our kids hydrated, and we support them, and they get better.
What's a sign that my child has RSV?
Well, it depends on their age group. So if they're kind of a younger child, maybe in that 3 to 5 range, we're going to see them with just a cough that won't quit. It's going to keep them up at night. And they're going to have a lot of congestion, but for the most part, they're going to be able to go about their day like normal. It's that younger population, those kids under 2, that when they get this illness, they're going to work hard to breathe. You're going to see them working faster to breathe. They're going to use extra muscles to breathe. And when that happens, it's harder to keep them hydrated. And sometimes they work so hard to breathe that we need to support their bodies with maybe a little bit of oxygen in a hospital setting. That's pretty rare, but that's what we're watching for.
And Scott, you probably see your population of kids very, very at risk.
Well, that's right. As Dr. Tony said, that we are seeing a lot of it anecdotally, and what's interesting is we're seeing a lot more in the summer than we typically do. And what I found is that I'm getting a lot of calls from emergency medicine docs, just regionally speaking, not just at one particular hospital, but a lot of the emergency docs are saying, oh, here comes another patient with RSV. So even emergency medicine specialists who aren't necessarily focused on kids, they see a kid come in with the symptoms that Dr. Tony just described, and they're saying, oh, here we go again. They're calling me, hey, this looks like RSV. They send an RSV test, and oftentimes it's positive. So it is certainly noticeable.
And you have concerns, I think, like so many people, about what's going to happen when the flu virus starts circulating this year.
Boy, that's a big concern of mine. Last year was a really unusual year in terms of viral spread. For the first time in my career, I saw 0 cases of influenza in children. I admitted 0 cases of RSV to the hospitals. I've never done that before in my career. And this year, if influenza follows the pattern that RSV does, boy, buckle up, because it could be a big surge in influenza this year. Luckily, we have a vaccine for that, and that is why I am encouraging all of my patients to protect themselves against the influenza virus by getting their flu shot.
We're going to talk about that and some more. We're going to open the phones for you. If you have questions about the COVID-19 vaccine, or I guess, let's just focus on the COVID-19 for this half hour. Love to have these guys back. We'll talk more broadly about child health in the future. But the number to call is 800-333-1190 or 447-1190. You can also text your questions to 46862. So where you would put a phone number, just put 46862. Send that question, and I will put it in front of Dr. Scott Myers and Dr. Tony Giaquinta. Okay, let's start with the basics around childhood COVID-19 vaccination. And I want to pull that back one layer and talk about what is it that makes children different than adults. A common phrase I hear around pediatrics is children are not small adults.
That's definitely a phrase that's hammered in very hard when you're going through a pediatric residency training program. And the basis for that phrasing is actually in physiology. We know that children have different heart rates, different metabolisms, different function in their immune systems. And so just extrapolating data from an adult to a child is not appropriate. But we also think about that phrasing when it comes to just in general, being cautious with children too. Sometimes we take extra risks with adults that we're a little bit more conservative with children as well. And so that's why, whenever we're doing a scientific study or research involving children, we have to take very particular attention that we're just not just dosing things down proportionally, but we're actually taking account their differences in physiology.
And that's one of the reasons, that's one of the complaints that I have heard from critics of this vaccine, and that is that the testing, the clinical trial was such a small population, less than 3,000 kids were administered this vaccine before Pfizer put it forward for approval. That's a pretty small population.
That's correct. And it's very important that we realize that when we did these studies that we didn't skip any steps. There's a little bit of a difference between speed and rushed. And when they did these trials, they were very careful to make sure that they were following every phase appropriately, phase 1, phase 2, phase 3, to get the results that they felt were deemed adequate and credible to make sure that it gets the stamp of approval that this vaccine is safe. And that's really what is at play here. Is this vaccine safe? And even though they looked at those 3,000 cases, remember we did kind of move down from adults to older children to younger children. So we did have a little bit of a heads up on how this vaccine would behave and how children would respond to it. And I surmise that if there were maybe 1, maybe 2 serious adverse effects in that 3,000 patients, they would probably say, we need more data, we need to study this more. But after they did all of those studies, they found that answer was 0. There were 0 serious adverse reactions in that study population, which for me is outstandingly reassuring and why I believe and feel very confident that this vaccine is safe.
And they are going to follow these kids going forward, so we'll know what happens.
Correct. And today, we've had over 1 million children in that age group have that vaccine, so that we are going to be able to watch this vaccine very carefully. And like the history of the COVID vaccine, this vaccine is under intense scrutiny so that any tiny little signal that shows up is going to be detected and we'll be able to respond appropriately. That's the history we had with the Johnson & Johnson vaccine, if you recall. About 30 days after giving that vaccine, a tiny signal went off suggesting there might be a risk between a certain population and blood clots. And what happened? They stopped it right there. They were very conservative in that approach, and I expect that same measure of caution with this vaccine.
Dr. Myers?
Well, we've talked before about myocarditis in teens, and we've talked about the data safety monitoring process. And the process of monitoring the safety data is something that is taken seriously. So while some people might have questions about certain aspects of how it was administered and the history of it, the bottom line is the data safety monitoring is fairly rigorous, and as we saw with the teens, it does seem to be overwhelmingly safe relative to exposure to the disease.
So myocarditis and pericarditis is inflammation of the heart tissue or the sac that surrounds the heart. So we have seen that occasionally, but it tends to resolve, right? I mean, these kids kind of just get through it.
Yeah, this disease is of concern. We are watching this very closely. And for me, I really need to watch to see what is more important? Is it going to be more important to, and this is where we are in the pandemic, by the way. With the disease spread currently, there are 2 options. Our children are either going to get vaccinated or they are going to get COVID, and maybe both. And so we have to make that decision. Which would we rather have? And we know that the risk of myocarditis is much higher in children that actually get COVID, the SARS-CoV-2 virus, than the children that get vaccinated for it. And we know after watching those children that after 6 months, that disease does resolve and the children are okay. Okay.
And we are here with Dr. Scott Myers. He is a pediatric oncologist and associate professor of medicine at IU School of Medicine here in Fort Wayne. Also, Dr. Tony Giaquinta. He is a local pediatrician here today in his role as the past president of the Indiana chapter of the American Academy of Pediatrics. And we are diving into the COVID-19 vaccine for our kids and our grandkids, ages 5 to 11, now authorized to be administered. What do we need to know about how this is different than the adult vaccine?
Well, I think the big thing to know is that the dose that they tested on children is 1/3 the dose approximately of the adult dose. And so when that's been a little bit of the challenge with the rollout is they can't just take the same vials and say, welcome in children 5 to 11. They actually have to have their own specific vials for this immunization. So that's really the big difference. The side effects are the same. It's going to be local tenderness, maybe a little malaise, which is just feeling blah for about 24 hours. Sometimes a low-grade fever, but most of those side effects go away in 24 hours.
Yeah, and the research did look at several different doses, and it's interesting. They in the articles they talk about orange caps and purple caps, and by looking at several different doses, they chose the lesser dose, which was fortunate from the standpoint that there were no serious side effects in any of the kids at all.
So, in your population, have you hospitalized any kids with COVID?
I've had to hospitalize one, which is so fortunate. I am so fortunate that this disease, being a pediatrician, has impacted children from a medical standpoint much less so than the adult population.
And I've also seen it in the subspecialty population, particularly with sickle cell disease, where patients with sickle cell disease have actually done better than we would have suspected, and they've done relatively well in terms of being able to get through it with supportive care, but we have had a number of patients with sickle cell disease requiring admission.
And that is a critical point that the opponents of childhood vaccination come to, and that is we're not seeing this disease be serious in kids. So the vaccine is safe, okay, it's safe, but is it necessary? A lot of parents are saying, I don't think my kid really needs this.
Yeah, for me, I think that's the most interesting part of this argument, and that is the part that I try to engage families, I think, with their hesitancy, which I completely understand. But yeah, we need to make sure it's safe. We need to make sure it's effective, and I think we've established those, in my opinion. But the big question is do we even need it? I think for me, one thing to point out is, even though I've only admitted one patient, I do not qualify this as a benign disease. We know that across the nation, hundreds of children have died. Tens of thousands have been hospitalized, and even extrapolating that further, I mean, there's 150,000 children who had a parent die from this illness. So this disease is impacting children from a medical standpoint. And now that we have a safe and effective treatment available, I don't think there is a number low enough to qualify this as acceptable death or morbidity or illness for not getting the COVID shot.
So your position is, if there is a way to prevent that one death, that's enough for everybody to have to be vaccinated? Do you want to see this go to a mandatory status?
What I'm trying to say is that if there is a safe and effective immunization available, I don't think we should be talking about only 2 deaths, only 3 deaths, or only 10 hospitalizations. If all of those are preventable, then we should be advocating and encouraging and really doing everything we can in our public health to make sure that our children have access to this vaccination.
And they do right now, right? I mean, it's widely available. Where are your patients Are they taking this vaccine? Are they jumping on board?
They have questions. Like you mentioned, about 1/3 are really excited to get this immunization, and they've been lining up and have probably already got their shots by now. I have about 1/3 of patients that are strictly opposed to it. They will never, and honestly, they're not open to even having that dialogue with me about it. And then there's that that third that have questions, that want to know, what are the long-term effects of this shot? What are the immediate effects of the shot? Why does my child need it? And those are the ones that I'm particularly wanting to engage that dialogue with. For me, what I also mention is that, yes, I do believe that there are medical benefits from getting this shot so that you don't get the disease. But I'm also quick to point out that COVID has impacted our children beyond the disease itself. This has been a tough year for kids. Every time they are quarantined, they get isolated, which has affected their mental health, their physical health for sure, and certainly their emotional health. I've treated children with more patients with depression in the last year than I ever have in my career. We see children being taken out of their sports, which for some of them is really how they keep their feet on the ground. And when that rug is really pulled from underneath them, boy, they really struggle with their mental health. And if this shot is one step closer to them becoming, going back to their routines and not having to be quarantined, not having to be tested every 2 weeks, not having to even wear masks, for crying out loud, boy, I think that we should be all in getting this vaccine for our children.
Critics are going to jump on that, though, and say those decisions, those restrictions on children, were policy-based decisions that were misfounded. That show me the evidence that there was enough risk to kids that required those things, that public health officials made mistakes.
Well, it was certainly public health decisions. The goal with all of those decisions was to try to keep children in their routines as much as they could. In other words, if we could try to prevent the spread of disease in schools by wearing masks, by doing all of the robust safety measures that our school systems were able to put in place, then they could stay in school longer and not have to be impacted by the deleterious consequences of being quarantined and being sent home. And in a large degree, that was a success. But now that we have a vaccine available, boy, wouldn't it be great to start to pull back on that to allow kids to not be quarantined as much if the child is exposed to coronavirus?
And that makes sense. And I just would echo too that what I've heard from not just parents, but also just some fellow pediatricians, is that it's also okay to wait for more data. And I think some of the parents who are in the category of not wanting it yet are going to watch for more data. And of course, we do have a lot of data already, but again, that's just what I'm hearing from some parents, from some pediatricians, that they're not against it, but they'll just be reassured when they see a little bit more data. So there is that sort of middle category as well.
I want to take the last moment or two that we have here and focus on the impact on public health issues that this has had. There is concern that vaccine hesitancy now has risen to a level that we have never seen before, and that there'll be less people taking the other vaccines that are available, the flu vaccine, the vaccines for the herpes simplex virus, which causes cervical cancer, all of that stuff. Were there mistakes made in public health that we're going to have to see some consequences of? How do we get past that?
It's going to be hard to determine if mistakes were made. I always point out that pandemics are always understood best in retrospect, and we are definitely going to learn a lot from this pandemic. We're going to learn about the impacts that we did make on children by putting them into these robust conservative measures to prevent disease, largely to benefit adults. What is going to be the impact of those decisions 20 years from now when these children grow up, and knowing that some of them had learning gaps during that year. Some of them certainly had emotional trauma and stress from being left more isolated and sent home. And these are all things that we are going to learn from for sure.
Dr. Myers?
Well, again, when I talk to parents and colleagues, I just try to look at the data objectively and speak to the risks and the benefits. I don't really consider myself to be for or against something as a political issue, but more just looking at the data, looking at the risks and the benefits. And I do think that my focus is just going forward in terms of trying to give people the best advice for parents who are asking, how do we make the best decision about the vaccine? And I think that hopefully what we've said here is a little bit helpful.
I hope so, too. We have to leave it there. That is Dr. Tony Giaquinta, local pediatrician, and another pediatrician, Dr. Scott Myers. Appreciate you being here, helping us out and get a better handle on the COVID vaccine for kids.